Hi guys, so today's video is gonna be a little bit different. As you can see, I'm recording in a little bit different place, so bear with me if you hear some noises here and there. Yeah, so from where we left off, we are discussing about different screening methods. So today's video, I'm gonna just be highlighting the different screening methods for cervical cancer, or cervical health rather, and we're just gonna get right into it because I don't want this to be a long video, so I'm just gonna make it short as much as possible. Yeah, so the first screening method that we have in Kenya, and it's available in not most of the facilities, some of the facilities, is HPV testing. So HPV, remember I mentioned that HPV stands for human papilloma virus. So the HPV test is supposed to be a test that checks for the virus that is causing the cervical cancer. So the test is basically a type of test that can be actually self-tested, or it can also be healthcare worker tested. So we have two types of HPV testing methods. One is self-sampling and the other one is healthcare worker assisted. Yeah, so moving on swiftly, I'll start with the first one, which is the self-sampling method. So the self-sampling method is a type of test basically which allows the woman to take their own swab or their own tests, and then it's put like in a tube. So basically I'll just explain to you how it's done, and maybe in another video I'm going to show you how the tube looks like. Yeah, so basically this is a type of test that is sort of like it's actually one of the self-care models that has been created to help women to be able to do their own tests, and basically also improve on uptake. So basically the self-sampling method is a type of a test whereby the woman is given like a tube like looks like, if you've gone for like a COVID test, you've seen those tubes that look like it's like a swab literally. So basically what the woman is supposed to do when they explain to the by the healthcare worker, that is, they just take the swab, put it inside their vagina, and then they rotate it like 5 times, and then they get the swab, and then it's taken to the lab, and then after maybe 1 to 4 weeks the results come back, and then they are given like so there are 3 types of results that can come up from HPV test. One is positive, the other one is negative, or it can come out as invalid. Yeah, so basically the test can come out as invalid, one, because the woman didn't take enough swab or enough, how would I say, like sample from the vagina. So when the sample is taken to the lab, then it comes out invalid because they weren't able to detect exactly the type of virus or type of infection that the woman might have. So the other reason could be also sometimes if a woman is basically maybe still on their periods, and maybe they weren't explained very well. So if the swab takes like any amount of blood, then it could also come out invalid, because it's basically supposed to take discharge that is in the vagina or the cervix, and not any other type of discharge that is blood. So these are some of the reasons why the test can come out invalid. So if the test comes out now negative, it means that they didn't find any HPV infection or virus in your vagina, or in your cervix rather. So basically what you're advised for HIV positive women, you're supposed to come back for a test after 3 years actually. But for HIV negative women, you can come after 5 years. So there are different intervals depending on your HIV status. For HIV positive women, you need to check them more regularly. That's why they might need to come after 3 years. So basically, the other type of test that I talked about is the healthcare worker assisted one. So it's similar to self-sampling. The only difference is that this one is a healthcare worker who is going to be taking the swab. So I think I don't need really to explain more about that. Yeah, so we are going to go to the second method of testing, which can still be done on its own as a standalone in low resource settings that do not have HPV testing. And the method is VIA, which means visual inspection with acetic acid. So as the method suggests, is that they need to basically insert a speculum to check your cervix if there are any changes, and then after that they're going to give you the results. So it's more dependent on visualizing, which means it can be a bit limited in terms of the training or the skills that the healthcare worker might have. Yeah. So in VIA, the results can come out via, as I mentioned earlier, is visual inspection with acetic acid. So we have either the test can come out as negative, which means there is no lesion, or the test can come out as positive, which means they saw a lesion or suspicions for cancer. Those are three types of results. So in negative, it means that they didn't see any changes. So basically, since I explained to you earlier, it's a visual inspection with acetic acid, which means they need to apply the acetic acid. So when they apply the acetic acid, the changes that come out is basically acetowhite. So if it's positive for VIA, it means that they saw the acetowhite changes in the cervix. So if the lesion is smaller enough, then there are treatment methods that are recommended for that. If the lesion is bigger, then there are other treatment methods that are recommended for that, which I'm going to talk about in another video. But today we're just going to... Okay, so the last screening method that I wanted to highlight today is pap smear. I'm sure most of you have heard about pap smear, or rather have even done a pap smear. So pap smear is the third screening method. And basically what it does is that it's sort of similar to HPV test, but this one they are going to be checking for cells, not the virus. So basically this type of testing, that is a pap smear, is a type of test whereby they'll take a swab. So this one can't be self-testing at all. It's only a healthcare worker who is supposed to do this one. So they insert a speculum, take a swab, then it's taken to the lab for basically in sort of analysis. So the analysis is supposed to check whether they have any changes that suspect there is any cancer. If they don't find any changes, it means that you're okay. Yeah, so if you have any question, I know I might have gone a little bit faster because, well, I'm in a public place. But if you have any questions, just let me know and I'll be able to explain a little bit more. So just to provide a recap, we've talked about three screening methods. One is HPV test, which can be either self-sampling or healthcare worker assisted. Secondly, we talked about VIA, which is visual inspection with acetic acid, which is mostly dependent on visualization. And then the third one is pap smear, which is basically a swab of the cells in your cervix, and then it's taken to a lab for inspection. So since now we are talking about the screening method, it's also very important that I also highlight the recommendations in terms of age. So for HPV test, it's only recommended for women who are 30 years and above. Sorry about the aeroplane. So it's recommended for 30 years and above, and this is because HPV takes 10 to 15 years before it develops to precancer. So basically it means that if you are exposed maybe at 20 years or maybe less, by the time you're reaching 30, then it's recommended that you get the HPV test, because then if they find the virus, the other procedure they're supposed to do is now VIA to find the extent of the lesion. So basically it's recommended for 30 years and above, because, well, if you do for less than 30 years, most of the women might be positive, but really, as I mentioned earlier, most of the HPV viruses are going to clear from the human's body, which means most of the time the woman might be positive, but it's going to clear by the time they are 30 years. So if it has not cleared by the time you are 30 years, then it means that it's a persistent infection, which means that you need to get your HPV test to be able to basically check whether there are any further changes and if the infection is now causing a lesion in your cervix. So for the women who are 25 to 49 years, you can do the pap test or VIA, that is visual inspection with acetic acid. Yeah, so basically the reason why I've actually said 25 to 49 years is because after 50 years there are some changes that happen, and they'll tell you which type of test is recommended after 50 years. But for women who are between 25 to 49 years, you can do the pap tests. So after 50 years, there are some changes that happen in a woman whereby you reach your menopause, which means the cervix is sort of going to like draw back, which means when they apply acetic acid, they may not be able to visualize the cervix fully. So for women who are 50 years and above, it's recommended that you do the pap test. But if you are 25 to 49 years, you can do both the pap test or visual inspection with acetic acid. So that's it for now. I think I'm gonna hold it there because I need to now focus on my date and lunch. This is on a Sunday. Actually, I'm recording this video. Yeah, so thank you so much for listening in. If you have any questions, please be sure to let me know. Thank you so much, and have a lovely day or evening or afternoon, depending on where you're watching me from. Bye bye. Love you guys.